But look at this disc bulging into the spinal cord. So now I would actually say to the patient, and I use this in my doctor's report, that now the messages from the brain are traveling down here. And what happens? They get to this point and they get impeded, they get stopped. So the messages to your heart, the messages to your digestive system, the messages to your pancreas, the messages that go down your legs. So you have sciatica. Guess what? If we don't correct this, that problem never goes away. When we start making a change in our practice to communicate the correction of subluxation and how that's such a devastating effect on human health and just transformation. When we start doing that and we use objective findings, especially x-ray measurements, we're measuring lateral cervical curves, we're measuring scoliosis, pelvic unleveling, we're measuring all these angles, the CD angle, and the lower dorsal angle. When we start translating this, it's really easy to get into this mode where you become so complicated in trying to communicate these curves and the changes in the spinal alignment to people that you start becoming a mechanic or a technician. And it's really important to recognize this, that if this is the level of your communication, so this is what happens, is that you get into this mode where people start asking you, how's my curve coming along? And when my curve is corrected, or how many visits do I have left in my correction care process? They're not thinking long term. They're not thinking lifetime care because they've not really associated the whole neurological aspect of getting that spine corrected. So this is where it becomes really important. So it's so vital to use when you talk about spinal curves or alignment, that is the direct effect on neurological function. And neurological function is the be all and end all of human existence, of human health. And so this is where we really need to be careful in our communication. So I'm going to go ahead and share my screen here. So this is the neurological impact of spinal correction. And again, the whole purpose of this is to help you with tools that you can express and communicate the neurological impact, the effect that subluxation or changes in spinal curvatures have on the spinal cord, and thus the ability for that person to heal and function at their full 100% capacity. You all obviously know that this is a relatively normal looking neck. We have a nice smooth curve. The person's facing to the right-hand side. And, you draw lines down the back of the vertebrae, that George's line, and these are not necessarily the lines that we would draw. This is an example that I just chose to use here. But even on this x-ray, it's important to note that there's some disc degeneration here. But generally, this is a good looking x-ray. So if we can help our patients get to this state, this is really important. Well, why is that important? Well, because it's actually been shown that at 43 to 45 degrees, that the spinal cord has the least amount of interference on it. The nerve messages, the neurological speed at which those messages communicate from the brain to the body are maximum when the spine's at 43 to 45 degrees. Okay, so there's the least amount of interference. That's the reason why we want this spine in that nice curvature. Well, obviously, if what happens is that we have then a subluxation pattern where the person starts to lose their curve. And obviously, this goes into a phase one. And when we have a phase one, and the thing is, it's really important to identify the fact that phase one is essentially just a misalignment. And I say just a misalignment because this is what I used to call the pre-arthritic state. So if somebody was in a phase one, the worst thing I could have done is minimize the damage in their mind. So that's why I always use the term pre-arthritic state. And I would always say, if this stays like this and you choose not to get this corrected, is this going to get better or worse? And I would ultimately sit there and wait until the person said it's going to get worse. So absolutely, this is going to get worse. So even though there's no degeneration, the discs still look good, there's good disc height, but I'm going to show you in a minute here why this is so devastating. So if the person chooses not to get this corrected, it goes into obviously a worst case scenario. And this is what happens, is that when that spine is misaligned, it degenerate. The acceleration of degeneration is faster, you know, and the spine will degenerate on a scale worse than the other joints in the body because there's so much stress on the spine. The spine is there, and this is a natural, innate body reaction that when the spine is misaligned, it adapts. Essentially, what it's trying to do, it's trying to fuse up. Because of the abnormal alignment, there's abnormal biomechanics. If there was injury to the spine in an abnormal alignment, the chances of that spine causing neurological damage or causing spinal cord even severing or nerve severing, nerve damage, neurological impact is huge. So the natural innate reaction is for the body to say, let's fuse this together to reduce the ability for that spine to move. So it's actually, this is a safety mechanism. Now, it's not a healthy safety mechanism because it's accelerating the damage, but it's doing so in a state where innate wants to protect those nerves. But obviously, we want to make sure we try to keep as much motion in there so it doesn't degenerate. Keep that spine in as good an alignment as possible. And I can tell you this from firsthand experience because when I had my injury, when I broke my neck in 2013, April 28th, 2013, and when I went into the hospital, the first doctor that I saw after the CAT scan told me that my I broke four bones in my neck, C4, C6, C7, T1. C7 was broken, 32 separate fracture segments. 32 fracture segments. The first doctor painted a very bleak picture. Like I would have permanent neurological damage. I would probably be in a wheelchair. I would need spinal surgery. Like it was terrible. In fact, to the point where I said to my wife, I don't want to live. If I have to be like, I don't want to live. It was a really traumatic time. So, but then when I was shipped to the other hospital, half an hour away, it was a spinal trauma center. And that doctor did the exam and said, he came back and actually told my wife, I was pumped up on medications and totally incoherent. But he actually said to my wife, he said, your husband's lucky. He said, he's obviously been in very good shape for the most of his life. And in talking to her, found out that we were both chiropractors. And he actually said, chiropractic care saved your life. He said, because your husband's cervical curve, his lordotic curve, is in perfect position. That C7 vertebrae shattered like a windshield. If a rock hit a windshield and it shattered into a million different fragments, like I said, 32 different bone fragments, he said if that cervical lordosis wasn't as good as it is, that those bone fragments would have exploded and gone everywhere. And if they exploded and went everywhere, he probably would have died, or he would have been a quadriplegic, or had very serious problems. But because that cervical spine was in such good lordotic position, that his spine stayed exactly. It was like a windshield that shattered, but nothing went anywhere. It stayed in exactly the proper place. So he said, frankly, chiropractic care saved your husband's life. And that was like an eye-opening experience to me. And I tell that to everybody, and I've said that on stage. And so that to me is a driving factor to say that this is why people need to have their spine in good alignment. Because here's the next thing. So this is what happened. And so it was interesting because we even used this before that time, but after that time, it took on a whole new meaning. Is that when I did my doctor's reports or I had an x-ray report, I actually had these pictures up on the wall. So these are MRI pictures. So we had a spinal degeneration state, like the different stages of spinal degeneration. Plus, we had these MRI pictures. And we actually also had them laminated, and I had them laminated, and I put like a ring around them. So I had each phase of the MRI pictures so I could show them to people and relate them to their x-rays. So I would have a normal x-ray, but this is actually a phase one. And obviously, keep in mind, this is going the opposite way. For education purposes, I had them all facing the same way so there was no confusion, right? So if you're going to use this, make it simple for people to understand. So, and I would actually say, so if you're in a phase one, look at what happens here. Now, here's the thing. This is a spine that's in a phase one. You can see forward head posture. There's an alordotic curve. And what happens, and this is so important for you guys, and this is why I get so excited about this, because this type of stuff will absolutely grow your practice. You start communicating this type of stuff, your practice just starts to explode because people start to get it. But here's something in a phase one. Now, look at, there's no degeneration in the spine. All the disc spaces look great. But as soon as you start to lose that lordotic curve and your spine goes forward, those discs are like jelly donuts or water balloons. We used to describe them just like that. And I would say to people that if if your spine shifts forward and that disc is sitting between those two bones, if the bones start to slide forward, which way does the disc bulge? And I would wait. And people would eventually say, well, it bulges backwards. And I'd say, exactly. Well, what's behind the disc? Well, the spinal cord. And you can actually see on this MRI view how these discs are actually bulging into the subarachnoid space. So they are actually disrupting the flow of CSF because you can see the bulges there. Now, there's no degeneration on this x ray. A medical doctor would look at this x-ray and say that's a normal x-ray, but that is far from normal because that immediately starts to impede neurological function. So I would tell patients that, and they could see it. Like you can see the bulging here on these discs in, through this MRI picture. So then take it a step further and say, okay, well, here we get into a phase two. Here's a phase two, and really you still have pretty good disc height between these bones. There's minimal degeneration. Like there's a small osteophyte on the front of that vertebrae. But look at this disc bulging into the spinal cord. So now I would actually say to the patient, and I use this in my doctor's report, that now the messages from the brain are traveling down here. And what happens? They get to this point and they get impeded. They get stopped. So the messages to your heart, the messages to your digestive system, the messages to your pancreas, the messages that go down your legs. So you have sciatica. Guess what? If we don't correct this, that problem never goes away. So this is so vital. So you have these pictures of the MRI that you can actually show this to people. And then you can take somebody that's in the next stage into a phase three, and then you have a spine with all this degeneration here. And now look at the spinal cord. So now I'm not just showing them the alignment of their curves or the lack of lordosis or saying, hey, you're in a phase two or a phase three. I'm actually showing them the effect on the spinal cord so that they know their body is literally dying. Their body is starving for nerve flow. No wonder they have high blood pressure. No wonder they're taking cholesterol drugs. No wonder they have depression. No wonder they have diabetes. No wonder they have some sort of Crohn's or colitis because those messages are not getting through to those organs, and there's no way that the body can adapt. There's no way that the body can assimilate itself. So this is part of the problem. So you can see how this spinal, look at that, there's subarachnoid space is gone here. So there's no flow of CSF. And this is important for you guys to know because it's not just about pinched nerves. It's about the whole entire system. The neurological system is so dense. Like our educated people and our educated minds don't even know the full effect of the entire neurology of how the body works and how it's so integrated. Because, and you look at the CSF here, look at this cerebral spinal fluid. The main functions of cerebral spinal fluid are to cushion the brain and spinal cord. So, obviously, that's very important when they're struck with any type of mechanical force. So, obviously, we want to keep that CSF flowing properly and don't impede it. To provide basic immunological protection, fantastic, to the central nervous system, to remove metabolic waste, as well to, look at this, transport neuromodulators and neurotransmitters. So the cerebral spinal fluid is 100% function and related to neurological function. So as soon as you have any type of impedance on that cerebral spinal fluid flow, you affect neurological function. So let's not fool ourselves into thinking that a subluxation is something minimal. And if you're not communicating the fact that subluxations are a precursor to disease, if you're not communicating the fact that subluxations are a precursor to early death, you are failing your patients. So start getting serious about this. This is really important stuff. When you start communicating the importance of this, when you understand it and understand how devastating that a subluxation in the spine is and how it affects the discs and how it promotes degeneration and causes osteophyte growth and causes extra calcification, but it affects the cord directly and it affects the flow of the CSF, that person cannot function properly. And I'm going to tell you, like if this is something that you're not communicating to your patients, you need to start communicating this to your patients. Get these pictures up on your wall and start relating spinal misalignment and subluxation, lack of spinal curves that take you from this mindset of a spinal mechanic or a technician into this neurological function. You then become a neurological healer. You are actually now talking to your patients about function and life and healing. And that's where the difference is. And that's what's going to take your practice from 100, 200, 300 people a week to 5, 6, 7, 1,000 people a week. That's where you start to get people that never want to leave. That's the big difference. So you adjust the spine, you change the brain. This is right from Dr. Monique's talk, and I actually copied this slide from her. But when you start adjusting the spine, you change the brain. And when you start changing the brain and the brain function, this goes so far beyond helping somebody get out of pain. You literally change somebody's life. You change their paradigm, you change the way they think, you change their relationships, you change their creativity, you change their relationship with their creator. You just change everything about them when you start adjusting them and they start functioning without interference. It's such a wonderful thing. And as soon as you guys start thinking that way, that's when your practice takes on a whole new meaning.